Dr. Henry, there's been a story just published in the South China Morning Post around BC's long-term care system. And the investigation found that more than 1,000 people at 42 homes where outbreak status was deliberately not declared when a low-risk staff fell ill. I don't know how much information you have on these sort of cases, but how concerned should people be that there wasn't a declaration of an outbreak in long-term care homes where there were sick staff?
Yeah, so I think we've learned a lot as we went through this pandemic, and we have outbreak management protocols that we put in place very early on. Initially, they were based on what we did for influenza, which usually has at least one sick resident or transmission within a facility, and then we recognized that was not sensitive enough. It didn't catch outbreaks early enough with this new virus, COVID. So it was the public health teams looked at where we were seeing transmission, and you remember early on how rapidly it would spread within facilities. So we do declare an outbreak with a single staff with exposure within the facility or a single resident in the facility, and that was across the board. Where we had some clinical judgment was if there was a single staff person who had not been in the facility during the period of time of their infectiousness, or had been fully adherent with the infection control precautions like wearing of PPE. Then there was a judgment made about the risk, and that was an enhanced surveillance where we did some extra monitoring and testing, and then if testing showed that anybody else was positive, then an outbreak was declared. So it was a way of making sure that we weren't overly cautious and putting in place those very severe measures that an outbreak entailed. And we know how hard it was on seniors and elders in long-term care. There were many, many cases where there were low-risk healthcare worker exposures. They may have become exposed in the community, been sick, but not been in a risky environment within the facility during the period of time they were infectious. And so most of those did not result in an outbreak, but those are the guidance that public health was following and was very meticulous about over the fall and winter.